Margaret had been living with arthritis pain for over a decade. Her doctor prescribed Celecoxib, and for the first time in years, she could walk without wincing. The pain was gone. But 3 months later, she was sitting in a cardiologist's office, wondering why her blood pressure had shot up and her ankles looked like balloons. What happened to Margaret is more common than most people realize. Celecoxib is one of the most widely prescribed pain medicines in America. Millions of people take it every single day for arthritis, joint pain, and inflammation. But very few truly understand what this drug is quietly doing inside their body. In this video, you'll learn 7 dangerous side effects of Celecoxib, both the ones doctors warn you about and the hidden effects that rarely get discussed. If you or someone you love is taking Celecoxib, you need to watch this to the very end. Celecoxib belongs to a class of drugs called COX-2 inhibitors. Unlike older pain relievers like ibuprofen or naproxen that block both COX-1 and COX-2 enzymes, Celecoxib specifically targets the COX-2 enzyme. That's the enzyme responsible for pain and inflammation. The idea was simple: block pain without damaging the stomach lining. And for millions of people, it works beautifully. It reduces swelling, eases joint stiffness, and brings genuine relief for conditions like osteoarthritis, rheumatoid arthritis, and acute pain from injuries or surgery. But here's what most people don't know. The COX enzymes do far more than control pain. When you block them, even selectively, you can trigger a chain of effects throughout the body. And some of those effects are serious enough that the FDA has placed a black box warning on this medication. That is the strongest warning the FDA can issue. So let's go through the 7 most dangerous side effects one by one. Effect number 1, cardiovascular risks. Heart attack and stroke. This is the side effect that shocked the medical world and led to the removal of similar drugs from the market years ago. Celecoxib increases the risk of serious cardiovascular events, including heart attacks and strokes. This risk is real, and it carries an FDA black box warning. Here's why it happens. COX-2 inhibitors shift the balance between 2 important substances in the blood. One is called prostacyclin, which protects blood vessels and prevents clotting. The other is called thromboxane, which promotes clotting. When Celecoxib blocks COX-2, it reduces prostacyclin without reducing thromboxane. The result? Blood becomes more prone to clotting. Arteries become more vulnerable. And for people who already have heart disease, high blood pressure, or diabetes, that imbalance can be dangerous. Studies have shown that the risk increases with higher doses and longer duration of use. People who take 200 milligrams daily for months are at greater risk than those using a short course for acute pain. If you have any history of heart disease or stroke, this is a serious conversation to have with your doctor before starting Celecoxib. Effect number 2, high blood pressure and fluid retention. This is what happened to Margaret. She felt better, but didn't realize Celecoxib was silently raising her blood pressure. This side effect is far more common than most patients expect. The kidneys use prostaglandins, the same substances that COX-2 helps create, to regulate blood flow and sodium excretion. When Celecoxib blocks COX-2, it disrupts this process. The kidneys hold on to more sodium and water. Blood volume increases, and blood pressure goes up. You might notice swelling in your feet, ankles, or legs. Your shoes may feel tighter. Your face may look puffier in the morning. These are signs of fluid retention, and they can appear within the first few weeks of use. For people who already have high blood pressure or are taking blood pressure medications, Celecoxib can make those conditions significantly harder to control. Regular monitoring of blood pressure is essential for anyone on this medication long-term. Effect number 3, gastrointestinal bleeding and stomach problems. One of the original selling points of Celecoxib was that it was gentler on the stomach than older NSAIDs. And while that's partially true, it doesn't mean your gut is completely safe. Celecoxib still carries a risk of gastrointestinal bleeding, ulcers, and stomach perforations, especially in older adults, people who smoke, those who drink alcohol regularly, or anyone already taking blood thinners or aspirin. The risk is lower than with ibuprofen or naproxen, but it is not zero. Warning signs include dark or tarry stools, vomiting blood, or a burning pain in the stomach that doesn't go away. These symptoms indicate bleeding in the digestive tract, and they are medical emergencies. If you experience any of these while taking Celecoxib, stop the medication and get to an emergency room immediately. Do not wait to see if it gets better on its own. Effect number 4, kidney damage, and reduced kidney function. The kidneys are quietly at risk when you take Celecoxib, especially if you are already dealing with diabetes or high blood pressure or are over the age of 60. Prostaglandins play a critical role in maintaining healthy blood flow to the kidneys. When Celecoxib suppresses these substances, blood flow to the kidneys can decrease. Over time, or even in the short term for vulnerable people, this can lead to reduced kidney function, a condition doctors call acute kidney injury. Symptoms can be subtle at first. You may notice less urine output than usual. You might feel more tired than expected. Swelling in the legs can also be a sign that the kidneys are struggling. Long-term use of Celecoxib in people with existing kidney problems can cause permanent damage. Your doctor should monitor kidney function through blood tests if you are on Celecoxib for an extended period. Effect number 5, liver toxicity, and elevated liver enzymes. This side effect is less common, but when it happens, it can be serious. Celecoxib is processed through the liver, and in some people, it can cause liver irritation or damage. Elevated liver enzymes on a blood test are often the first sign. Most of the time, this is mild and resolves when the medication is stopped. But in rare cases, Celecoxib has been linked to severe liver injury, including hepatitis and liver failure. People who drink alcohol regularly or who already have liver disease are at considerably higher risk. Warning signs of liver problems include yellowing of the skin or eyes, which is called jaundice, dark urine, upper right abdominal pain, or unusual fatigue. These should never be ignored. If you develop any of these symptoms while taking Celecoxib, contact your doctor immediately. Liver toxicity from any medication is a situation that requires urgent medical attention. Effect number 6, allergic reactions, and skin conditions. Celecoxib belongs to a class of drugs called sulfonamides, and people who are allergic to sulfa drugs or aspirin should be extremely cautious. Allergic reactions to Celecoxib can range from mild to life-threatening. On the milder end, you might develop a skin rash, hives, or itching, but in more serious cases, Celecoxib has been linked to severe skin reactions, including Stevens-Johnson syndrome, a rare but potentially fatal condition where the skin blisters and peels from the inside out. This is one reason why the FDA warning label specifically highlights skin reactions as a danger to watch for. If you notice any unusual skin changes, blistering, or peeling after starting Celecoxib, stop the medication immediately and seek medical care. Do not try to treat a suspected allergic reaction at home. Reactions can escalate rapidly and require professional intervention. People with a known aspirin sensitivity or NSAID allergy must inform their doctor before Celecoxib is prescribed. Effect number 7, interactions with other medications. This is one of the most overlooked dangers, particularly for older adults who are often managing multiple conditions and taking multiple medications at the same time. Celecoxib has significant interactions with several commonly prescribed drugs. If you are taking blood thinners like warfarin, Celecoxib can increase your bleeding risk dramatically. If you are on lithium for bipolar disorder, Celecoxib can raise lithium levels in your blood to dangerous concentrations. If you take ACE inhibitors or ARBs for blood pressure, Celecoxib can reduce their effectiveness and further stress the kidneys. And if you take low-dose aspirin for heart protection while also taking Celecoxib, you lose much of the stomach protective advantage that Celecoxib was supposed to offer. With 20 years in the pharmaceutical field, I have seen patients experience serious complications simply because their doctors and pharmacists were not fully aware of every medication on their list. Always carry a complete list of every drug you take, including vitamins and supplements, and review it with your doctor before starting Celecoxib. Not everyone reacts to Celecoxib the same way. Some people take it for years without major problems. Others experience serious side effects within weeks. The difference often comes down to individual risk factors. You are at higher risk if you are over the age of 65. Older adults process medications more slowly, and their kidneys, heart, and liver are more sensitive to the drug's effects. You are also at higher risk if you have existing heart disease, high blood pressure, diabetes, kidney disease, or a history of stomach ulcers. Smokers, heavy drinkers, and people who take aspirin or blood thinners alongside Celecoxib face significantly elevated risks of bleeding and cardiovascular events. And if you are allergic to sulfa drugs or have had a reaction to any NSAID in the past, Celecoxib may not be safe for you at all. Always disclose your complete medical history before starting this medication. If your doctor has prescribed Celecoxib and the benefits outweigh the risks for your situation, there are smart steps you can take to protect yourself. Always take the lowest dose that controls your pain. Do not take more than prescribed, and do not take it for longer than your doctor recommends. Take Celecoxib with food to reduce the chance of stomach irritation, even though it's gentler than older NSAIDs. Have your blood pressure checked regularly, especially in the first few months. If you are on Celecoxib long-term, your doctor should periodically check your kidney function and liver enzymes through blood tests. Avoid alcohol while taking this medication. Alcohol increases the risk of stomach bleeding and liver strain. And never combine Celecoxib with other NSAIDs like ibuprofen or naproxen, as this combination dramatically increases side effect risk with no added benefit. If you notice any unusual symptoms, swelling, changes in urination, chest pain, shortness of breath, or skin reactions, contact your doctor immediately. Do not wait for your next scheduled appointment. Early action can prevent a manageable side effect from becoming a medical emergency. Let's quickly go over what we covered today. Celecoxib is a powerful anti-inflammatory medication that helps millions of people manage arthritis and pain. But it comes with 7 dangerous side effects you must know about. Number 1. Heart attack and stroke risk, which is backed by an FDA black box warning. Number 2. High blood pressure and fluid retention affecting the kidney's ability to regulate sodium. Number 3. Gastrointestinal bleeding and ulcers, even though it's safer than older NSAIDs. Number 4. Kidney damage, especially in older adults and those with diabetes. Number 5. Liver toxicity, which can be serious in heavy drinkers or those with liver disease. Number 6. Severe allergic and skin reactions, including rare but life-threatening conditions. Number 7. Dangerous drug interactions, particularly with blood thinners, lithium, and blood pressure medications. Each of these risks depends on your dose, your age, and your overall health profile. Celecoxib can be a life-changing medication when used carefully and under proper medical supervision. But it is not a drug to take casually or indefinitely without monitoring. If you are currently taking Celecoxib, or if your doctor has recommended it, I encourage you to have an open, detailed conversation about your personal risk factors. Knowledge is the most powerful tool you have for protecting your health. Have you or someone you know experienced any of these side effects while taking Celecoxib? Share your story in the comments below. Your experience might be exactly what someone else needs to hear before making a decision about their own health. If this video helped you understand Celecoxib better, please like it and share it with someone who needs to see it. And if you haven't subscribed yet, hit that subscribe button so you never miss an episode of Behind Medicine. Remember, This video is for educational purposes only. Always talk to your doctor before making any changes to your treatment. Stay informed, stay safe, and take care of your health.